let's switch a little bit to talk about neuromodulation and brain-based interventions for
Totally.
substance use disorder. For listeners who are comfortable with psychopharma, but not devices, how do you define neuromodulation in psychiatry, and what are the main modalities they should know by name?
Yeah. So, when you're thinking about treatments for psychiatry, I think this is, in some ways, it's been founded for quite some time when you think of ECT, electroconvulsive therapy. But there are newer modalities, as you're saying, TMS, transcranial magnetic stimulation. There's focused ultrasounds, there's DBS, deep brain stimulation, VNS, vagal nerve stimulation. And so all these things, as kind of the name suggests, they're different stimulations or focal points where you're using technology, some form of, like I said, ultrasound waves, shock waves, or other multitudes or modalities to really ensure that you're affecting the brain on a more physical respect rather than trying to change it through changing somebody's thought patterns or changing the neurotransmitters that are available. And so in that respect, it's just another avenue to continue to treat individuals.
Conceptually, how do you explain the logic of targeting prefrontal control circuits to influence craving, compulsivity, and decision making in addiction?
Yeah, so one of the ways that it's thought about, obviously, a lot of these circuits are one interconnected. So you affect one, ultimately, there's going to be a downstream cascade to others. So that's one area of it. But when we're talking about the prefrontal cortex, this is the area of the brain that's specifically involved in planning, executive functioning, and really being able to make coordinated events occur. And so when you think about individuals who use substances, there's a lot of stigma, they're dumb, they, can't think right. Why can't they just stop these things? But you recognize the action of going from a craving, let's say they walk past or they see an ad about like cannabis or something, and they're like, okay, I want to smoke now. Now they have to get money or access funds if they don't already have them. They have to make a decision, where can I get it? The dispensary, is there somebody that they know on some personal level? Coordinate getting there, getting it, either having the person drop it off to them, go pick it up, and then have the tools and instruments appropriate to then use it. So that's like a 5 6 step process in itself. And again, notice how all of this is planning, coordinating. It's not this random act of, oh, I want to smoke, and it just, pops up in their hands or in their mouth or whatever. And trying to decide, are they going to smoke it? Is it, when you think about cannabis, it's going to be an edible. When you think about opioids, there's injections, intranasal, like there's so many different ways, and, trying to make decisions on which one you're going to use. So when you think about that, again, all the planning, all the coordination goes on in that. That is kind of where the prefrontal cortex plays a role. And so in that respect, that's kind of one of the focal points that is addressed, trying, or that is being considered in its utilization.
Mhm. And you talked a little bit about how things such as, transitions in career positions might impact an athlete's mental health.
Hmm.
Um, there's some epidemiological data that says that, risk for overall mental health burden spikes around things like injury, underperformance, and
Yep.
transitions, like you mentioned. How should that shape screening and follow up schedules for psychiatrists working with athletes?
Well, I think it's really just recognizing that at those times they're at higher risk. Does that mean they need to see somebody just because they're in that period? No, not inherent, not at a higher risk or at a higher degree than they already are, but it's very much being cautious and tentative to that, recognizing changes in their patterns, some of which you would expect. They're injured, they're not going to come to workouts and things like that. But the question is, are they isolating beyond that? Are they still in contact with their teammates, or are they just, not, zero dark 30 in a room, not talking to anybody? Um, Again, you're taking away a portion of their scheduling and their routines. How are they adapting to that? How are they filling that time? Are they just laying at home in bed, and very upset about this? Are they able to find another avenue for them to explore, art or media, or some other engagement that they can do? So it's looking at those nuanced things of how are they adapting to the life with this new injury or with this potential trade. because we recognize, there's all these sports documentaries and things like that where you see how much this impacts people. One of the things that comes to mind is I remember Derrick Rose put out a little media clip about when he was getting traded from Chicago and how he found out through media itself, like on ESPN, and then got a call from his agent and was like actively crying. He's like, "Is this real? Like, I love Chicago." Like, people are so invested in these spaces, in their careers, in these teammates, and then in a fell swoop, they're taken away. And so trying to process with them, essentially the process of grief, having to deal with loss and how can they adapt and overcome that, I think is really key. So having more touch points is always great, but I think beyond that, it's really interacting, with their family, with the coaches, with the trainers, like how are they overall and how are they adapting?